next up, we have Nancy Bradshaw from the Ministry of Labor, Training and Skills Development. And Nancy and I are going to tag team on this one. I've been lucky enough to work with Nancy the last little while on this project. So Nancy's been working at the Ministry of Labor, Training and Skills Development for 3 years. First as a member of the Secretariat for the Prevention of Workplace Violence in Healthcare project, and for the past 2 years as co-leading with me on the occupational illness portfolio in the ministry's prevention division. Her background is in health promotion, and she worked at Cancer Care Ontario and was the co-chair of the Environmental and Occupational Working Group of Toronto's Cancer Prevention Coalition prior to joining the ministry. So welcome to Nancy and myself. I'll join in with you.
Great to be working with you too, Kimberly.
This is the famous slide you see quite frequently, and especially it's the impetus for this October and beyond session. And when we had the Chief Prevention Officer introduced at the beginning, we were hoping to do a presentation for you then, but it just fit better in the closing, just to update people on the Occupational Illness Prevention Plan members, previously the ODAP, same people doing same good work. Just kudos to all of our system partners, and really the idea here is continued collaboration, as you've seen in all the earlier iterations. We still have all the same members, and we want to expand members. We have CCOHS, we have CROSH, we have public health. We want more involvement with the Ministry of Health. We want more collaborations, as you can see, with us involving Health Canada as much as we can in projects. So we're looking to expand where we can reduce occupational illness through this project. So I did just want to remind us of from where we came, and really we won't go over, you've seen this, you can go back, but really in 2019, I did want to draw people's attention to the Ontario Auditor General report. And one of the major recommendations was to reduce the incidence and burden of occupational disease. And they recommended continuing with ODAP's plan and activities. And again, while assessing its effectiveness and making adjustments if necessary. So that's where we got into changes going forward. So that was kind of the introductory piece to the next couple of years. Well, and then 2020 happened. What else can we say about 2020? COVID happened, and everyone shifted to COVID more as they should. We did, though, keep working on all of the occupational disease action plan, and some amazing work continued to happen. Paul Demir's report was published. There was a physician clinicians toolkit created. You're going to hear more from us on updates to the occupational exposure limit adjust tool. And we really, really wanted to focus on action beyond awareness in 2020. And then we're bringing you to 2021, where there was a working group. And I do want to take a minute to thank, I think I saw some folks in the audience today, and the working group that did this analysis and looked at the new objectives and how we were going to go about shifting and reviewing the ODAP work into the OC Illness Plan. Included Mike Parent from Workplace Safety North, Vanessa Blount from WSIB, Janet Brown and Lynn from CREOD, Paul Demirs from the Occupational Cancer Research Center, Wagish Yajaman from WSPS, Victoria Arundale from U of T, and Nick Rajram, and of course all the Ministry of Labor Training and Skills Development folks. We're very happy to have the groups together. So I did want to take a minute to thank them. So in that group, we came up with the new worked with the new occupational health and safety system strategy, which I'll turn over to Nancy now, and came up with what that OC illness prevention program would look like, and just reported that back to the steering committee, looking for collective impact, looking to be evidence-based and driven, and really what we've been talking about for this whole October and beyond session, trying to get etch out performance measures. So we want to have impact. We want OC illness to be reduced. We want exposures to be reduced. we know that that goes hand in hand with awareness, but it must be the priority.
So as Kimberly mentioned, we, and I think most of you would know this, we did release a new occupational health and safety strategy called Prevention Works. This was released in July, and it's really a strategy, vision, blueprint for occupational health and safety in the more intermediate and longer term, because we're looking over a 5-year period. And we know changes, as Kimberly was talking about, action. Changes usually take more than 1 or 2 years. So it's a 5-year strategy. And we want to make sure that Ontario continues to be one of the safest places to work in the years to come. It was developed based on recommendations from the Auditor General's report, which Kimberly was just talking about, the one related to ODAP. Also extensive research and province-wide consultations. And I see some of the folks that are in the audience today were part of those consultations. So thanks for joining us on those. We also had a socialization roadshow where we reviewed the strategy with a number of stakeholders prior to its release, made some modifications, and some of the people that we consulted with included the Canadian Federation of Independent Business, Business Council on Occupational Health and Safety, and the Ontario Federation of Labour. And through Prevention Works, the occupational health and safety system, we're moving to an evidence-informed, risk-based model where prevention initiatives will be are outcome-focused, measurable, and we're looking at continuous improvement. Prevention Works includes four objectives and 2 areas of systems focus. I'll go through this relatively quickly. Again, I think most of you know this. The first objective is to build and use the best evidence to target our initiatives. And again, we're back to that message about measuring our performance, increasing oversight, ensuring continuous improvement. Objective 2 is about improving occupational health and safety knowledge and practices. Objective 3 is about supporting workplace parties to fulfill their occupational health and safety roles and responsibilities and achieve excellence. Objective 4 is about making occupational health and safety easier for small businesses. And then what we're talking about today, of course, is one of the areas of systems focus. And I did not add the word prevention, but we can add it to the PDF when we share it. It should say here, occupational illness prevention, and the other one is work-related mental health and workplace violence and harassment. When we went about this work, working with our working group, and I also thank everybody who was on our working group to help us develop this framework for moving forward. The first thing you do is we look at what the problem is, and the problem has been and continues to be, we know that Ontario workers are exposed to occupational hazards at levels that cause illness. This results in a high burden to the system and certainly to individuals and their families. So there are, of course, both economic and societal costs and personal costs. I've included some stats up here that are from WSIB, which is great, but we know that these stats only, especially for things like occupational cancers, only account for about maybe 5 to 10% of the illnesses. So they greatly underestimate the prevalence and burden of occupational illness. And a lot of this is due to under-recognition and under-reporting. So in our new plan, we're also focusing on under-recognition and under-reporting. So that's a focus in addition to looking at the focus on occupational hazards and preventing and controlling occupational hazards. We know that when illnesses are under-reported and under-recognized, prevention opportunities their impact, and emerging issues aren't identified. And this was highlighted as well in Paul Demers' report. We also know that workers don't receive the compensation benefits, and healthcare costs are inappropriately borne by the public health insurance system due to under-recognition and under-reporting. So those are just some of the consequences.
And really, just to build on what Nancy said, we're focusing on, and as I mentioned, reducing exposures and dealing with improving recognition and reporting of occupational illness. Those are the three thrusts of what we're trying to do here. And we're going to do that by these things flying in a circle that I still haven't decided what we are actually going to call. In the system that creates these, they're called activities, but they're really, and they used to be called approaches. And really their objectives, their buckets, I don't know. Anyway, what we're going to do is build strategic partnerships, and Health Canada right before shows the need, the Ministry of Environment, the Ministry of Health, like we have to build strategic partnerships with certain things to get what we need done. Things like the electronic medical record, we're not dropping that out. That is going to belong within building strategic partnerships. The research and data analytics and making sure we have centralized access to this to do the right thing. Training and education is not going away. We're not saying that awareness or training is absolutely hand in hand. But the new one is to develop and share workplace tools. And you saw that in our session last week or last time around. You see that in our accomplishments that we're going to report on. And again, updating regulations and enforcing legislation. You heard from Briar in this October and beyond session, and we're going to hear from Shirley where we built tools around regulatory updates that will help people comply and help small business and all of those other things. So
one of the things that we did, which is something we did this when we first developed ODAP, was to look at specific exposures that we would focus on. And so we've adopted that approach again. We created a survey we created an evidence table with 13 different hazards, the top hazards, based on our research and also speaking with our stakeholders, and asked the stakeholders to complete the survey looking at the need and the impact. So the need to focus the greatest prevention efforts, looking at prevalence, severity. As I mentioned before, there's economic burden, also relevance, our distinct role in prevention and control of exposures. Are we in a lead role based on our mandate, or is it an opportunity to play more of a supporting role? Also impact, of course, impact from the prevention perspective, considering if it's a 5-year plan. And something that we added to this year was looking at innovation and equity. That was considered very important by from our working group. So we've added that lens as well.
Remind us that we didn't reinvent the wheel here with our priorities ranking. We took the good work that the Ontario Auditor General mentioned, and we reviewed it. So we looked at this, we updated the data and the evidence, but we looked at quite a similar ranking that was done the last time around. I wanted to remind you of the priorities, the important priorities that were in ODAP before. So next.
Yes. So this is the list of. It should be 14. Welding fumes is a bit of an outlier. It was in our list, but for whatever reason, only 2 people ranked it. So these are the results of the need and impact ranking. I won't read them out. There's no need to read them out, but you can see at the top, we've got, well, let's go to the next slide and you'll see the grouped one. Okay, so the overall ranking: noise, biological hazards, crystalline silica, and allergens and irritants actually tied for 3rd place. Heat stress, asbestos, diesel exhaust, and solar UV radiation were the top 7. very similar to what we were doing in the past. And I think that's what Kimberly wanted to point out. And we will ask the group to comment on this in a few minutes, but that was the ranking. There were, we approached 12 organizations. We received feedback from 8. So we had a pretty good response to this survey. And it also showed that the work that we were doing before, as Kimberly mentioned, was relevant. It's still very relevant work.
I just wanted to show, you know, what else was discussed at that steering committee. So we, along with the priorities, remember those buckets, I'll call them for lack of a better word, building strategic partnerships, research and data, education and training. And I'll speak to the one I know the most, because we also spoke to it earlier on in October, last week, with Melanie Gormaning, was this potential project around the silica control tool. This is an example of how, okay, we have a tool, we partnered with CCOHS and Infrastructure Health and Safety Association and the BC Construction Safety Alliance, and we're bringing that pilot to you in Ontario. So that would be an example. There are others, and Nancy, jump in. We didn't want to go into great detail, and we're trying to catch time a little here, but you know, this is how the whole system, and then we will develop performance measures around some of these. So we will we'll take priorities and lay them over these buckets per se, and then you know, set up performance measures with them, and there will be more than one project going on. These are all just little examples. Yeah.
One thing I will just say very quickly is we are doing a review of the Joint Health and Safety certification, and just as an example, the members of this OI steering committee have been forwarded to that group. So to add that occupational illness huge lens.
Yeah, thanks for mentioning that. I mean, it's huge. It's really that we want, you know, the everyday messaging in health and safety to involve health. You know, it's not, that's, that seems, you know, the health part gets forgotten in the safety training. So that, you know, the fact that we're reviewing Joint Health and Safety Committee training to make sure disease prevention is very prominent and updated is, thank you. Thanks for mentioning that. And so yeah, we wanted to come back and chat to you guys, and we're, so go ahead, Nancy, I'll let you do question 1.
Oh, so it's very open-ended. So the first question is, did these priority exposures resonate with you?
While you're thinking of that, and please enter in the chat as you wish, answers, or go ahead and unmute. We don't have a giant group today. We did want to make this a little bit more interactive, and maybe a way that you would know if they resonated with you, and we'll is what you might be doing, because we want you to join. We want you involved as stakeholders, as workers, as worker reps, as Joint Health and Safety Committee members, as professionals, in doing something about these priorities, and about, oh, great, heat stress is a surprise. Yeah, climate change folded over a lot of our commentary back from these surveys, Daryl, and it seemed that we need to, you know, look at the world and climate change, and how it's changing, you know, what we need to concentrate on. So that was there was a lot of feedback that climate change affected sort of our survey.
And absolutely, and with that, if you look at solar UV radiation, you know, then, you know, is there an opportunity to combine some of the messaging? And I think certainly there is an opportunity to combine this on safety messaging, and as well as the messaging on heat stress. Yes.
Yes, thank you. Yes, is wearing masks is contributing to overheating?
Yes.
Like, again, changing work environments, changing variables, right? So excellent. Yeah. So we're looking, if you have things you'd like to do to action to reduce exposures in your workplace, like, what do you need from us? You know, what what might cause, what will help with underreporting and recognition. Could be combined with biological hazards. Nice, Terrell. Yeah, excellent. I see your point there. So if anyone wants to unmute, feel free. If you want to write in the chat, but we did just want it to be a tiny bit more interactive with the questions here if we could, but we also acknowledge that we want to move on as well. So don't be shy, but maybe we'll give another second, but oh, go ahead, Jen. You can click. Oh, yes, more testing of ventilation systems. Yeah, we know the hierarchy of controls. We also want to focus on it. So thank you. And we know that for all these respiratory hazards or lung and other illnesses, that, you know, getting it out of your breathing zone is one of the best things that we can do after substitution. It's engineering controls. So thank you. Making sure we have ventilation. So we wanted to throw a couple of ideas your way. Can you discuss, are you putting occupational illness prevention on your Joint Health and Safety Committee agendas? Do you proactively discuss it? Are you looking at occupational illness reports? We had Breyer speak about a new reporting mechanism that's available that Joint Health and Safety can now view with that new legislation that came in July. You can participate in the silica control tool pilot that I talked about last week. And again, you can review stats at the OCRC's Octaz's stats website that they created as part of this project. So
Workplace Safety Plan Builder. And so that was developed by our Pandemic Safety Workplace branch. The Safety Plan Builder was, it's a COVID-19, of course, Safety Plan Builder. It's an approach that helps employers think through some of the risks in the workplace and choose actions they'll take to make the workplace safer. It was launched in September. It's a free online and interactive platform that makes it easier and faster for employers to create a plan to address the risks of exposures to workplace hazards like COVID-19 in the workplace. And it leads the user through an easy 3-step process to help them develop a customized plan. It was developed with small businesses in mind and includes small business owners in its design. With the input of users, the platform will continue to evolve to meet the needs of business owners across Ontario. And business owners can sign up to receive the latest updates on health and safety topics. So I don't have much more to say about that. Kimberly, you could probably speak to a number of these other ones.
Yeah, you know what? I think I won't, because people will get the links later and they can play with it. I will mention, we wanted to include all the system partners doing amazing work. And the links you'll be able to view later if you haven't yet. And we're actually going to have Shirley show the occupational exposure limit adjust tool now. And as part of our little stretch break. And you please go back and view some of this great work. And this is not all inclusive. So we definitely just wanted to show a few of the recent over 2020-21 accomplishments around disease prevention. So please go back and take a look at this, and when we put the slides up, you'll be able to link right to them. So I think, Nancy, and we kind of took questions when we spoke, so I need to catch about 5 minutes. And I'm thinking that if you're okay, I think we asked questions as okay. We might close out this session, and with great thanks, Nancy. Thanks for bringing everyone up to speed on all the great work. And we'll maybe shift over to Shirley now and catch some time.
Thank you. Thanks so much, Kimberly. Always a pleasure.
Always a pleasure. Thanks. Good working with you.